Good morning, everyone, or good evening, wherever you're coming to us around the world. So excited to see all of your names and faces, and on our Zoom. As we get our presentation going, I just wanted to take a moment to welcome everyone. So we're really thrilled that you're all joining us here today to learn more about our fellowship at our UCSF Center for Health Equity in Surgery and Anesthesia, aka also known as CHESA. So my name is Sri Ranjani Padmanabhan. Everyone calls me Sri. I'm an ophthalmologist at UCSF, and I'm one of the co-directors of our fellowship. So we're just going to take a bit of maybe another minute or two to get things going, and then we'll talk about our fellowship. All right. So I think we can go ahead to our next slide. So on our agenda for today, you're going to hear from both myself and two of my colleagues about the Open CHESA Fellowship application. Dr. Leah Jacobson, one of our co-directors of the fellowship, who will give us a snapshot of the fellow experience and our offerings, and then also Zaina Tamalier, who's our program coordinator for CHESA, and she will share the basics of our application requirements and process. Next slide. We'd like to just take a moment to introduce you all to CHESA, the institution itself, and then dive into our fellowship. So the mission here at CHESA is to advance equity in surgery, anesthesia, and perioperative care all throughout the world through ethical and innovative academic engagement. So one of CHESA's primary goals is to dispel the notion that global health work is somehow charity work or simply research in a poor country outside the United States. Health equity is a challenge for everyone, everywhere, inside the US and all over the world. And our programming is focused on addressing disparities, not only here in the United States, but also internationally. Next slide. So CHESA is one of 6 core centers under the University of California, San Francisco's Institute for Global Health Sciences. CHESA is the evolution of numerous global health initiatives at our university. So the group came together in 2020, right before the pandemic, when the UCSF Anesthesia Division of Global Health Equity merged with the UCSF Center for Global Surgical Studies and other UCSF departments. And it builds on longstanding partnerships with institutions from around the world. We are working with the UCSF Department of Emergency Medicine to co-lead the UCSF World Health Organization and collaborating centers for emergency, critical, and operative care. Our membership includes over 300 faculty, colleagues, and partners from 10 different clinical departments within our university, as well as colleagues outside of UCSF at collaborating institutions. And our leadership spans multiple perioperative disciplines. Next slide. So our CHESA fellowship is co-directed, by myself, Dr. Leah Jacobson, and Dr. Kathy Kiliwalia. And we are responsible for overseeing the growth and implementation of the program. So Zaina Tamalier is our project management lead for our fellowship, as well as the program coordinator for the entire center. So we are really also grateful for the support from our larger CHESA leadership, including our director, Daruk Ozgadez, our deputy director, Patty Orozco, and our associate director, Michael Lipnick, who provides technical and administrative guidance, as well as support, and serves as additional resources for ourselves and as additional mentors for our fellows. So at CHESA, our team supports our fellows from the application process through the fellowship and beyond once they become alumni, and our support is designed to mobilize expertise and resources that exist within UCSF and our global community of fellows and CHESA members and partners. And so now I'd like to hand it over to my colleague, Leah, Dr. Jacobson, to share more about the fellowship experience and our offerings.
Thanks, Sri. It's great to meet everybody, and thank you for joining us this morning. As Shri mentioned, I'm one of the co-directors of the fellowship and pediatric ENT surgeon here at UCSF, and it's lovely to have everybody. So we can go to the next slide, Zaina. Great. So I'll go over kind of the overview of the fellowship itself and sort of the different components of it. Our goal really in this fellowship is to foster the next generation of global health leaders in surgery and anesthesia in the perioperative space. And the fellowship is designed as a 12-year part-time non-ACGMA fellowship that is held remotely. And it's for individuals who are really dedicated to developing a career that focuses on advancing health equity in the field of perioperative care. So any aspect of surgery and the structures around it. So it's open to physicians, and in this coming year, we'll be opening it up to some nursing staff as well, who are in the multiple subspecialties across surgery and anesthesia. Our fellowship is structured to include a global health curriculum. Fellows receive mentorship, training, research, and career development support, which I'll discuss a little bit more this morning. And fellows are, in joining the fellowship, you sort of enter into a diverse community of surgery and anesthesia providers who are all dedicated to making a transformative impact in the health systems and communities they serve. And this fellowship was born out of a very longstanding partnership between UCSF and health providers and scholars in Uganda through the Global Partners in Surgery and Anesthesia program, which has supported over the years a number of faculty in Uganda and resulted in a lot of in-country retention of healthcare providers there who provide clinical service and sustain local research and capacity building programs there. So this is sort of the history of CHESA and this fellowship program. Next slide. So we have 4 main objectives with the fellowship. The first, and sort of what we hope to offer fellows, in terms of career development and leadership, we work with fellows to sort of create and refine their career development objectives and develop skills in global health equity. As educators, researchers, mentors, and advocates, this is done through a number of resources, including the UCSF mentorship, and then a number of lecture series focused around sort of career development in this field through a number of really wonderful faculty that we have both here at UCSF and in Uganda who have done this work into their careers. In regards to education and training, fellows will develop expertise in core areas in global health equity, and we have a structured curriculum to help support that. Scholarship and research, so fellows will learn how to describe key qualitative and quantitative methodologies common for global health equity research, and part of the fellowship program is a year-long project that each fellow will come into the fellowship having identified at least the structure of a project that they hope to develop over the course of the year. And then our job is really to support that through a number of means. We have coursework in research, we have the core curriculum itself, and then of course mentorship, and then mentorship and community. So the structure of the fellowship, we meet a couple times a month. I'll go into more details on that, but it really is, the effort is to create a community across, many different countries so that people aren't working in a silo, working on their own, but have the support of an entire community of people doing this kind of work, as well as mentorship, both in their local practice settings as well as at UCSF. So we really try to build a support network so that we can all learn from each other and support each other. Next slide. So some of the benefits of the fellowship, as I mentioned, we do try to pair you with a UCSF mentor. Some people come into the fellowship already having identified one. Others will work together to kind of find somebody who might be able to help mentor you within the the big network of CHESA faculty that we have here. The program is very flexible, so it allows fellows to participate part-time, as most people are fully in clinical practice when they join this fellowship program, and we are aware of that and try to accommodate that. It's offered virtually, so regardless of where you are in the world, you can participate. As long as there's some stable internet connection, and we do work on that. And we realize there are limitations to that as well from time to time. And then, there's ongoing priorities. And so all of the different sort of coursework that we offer tends to have a bit of flexibility, where there's the ability to sort of do work sort of in a self-guided fashion and then come back as a group to discuss. It is a global community, as we've discussed, and we'll go into it a little bit more about our current fellowship cohort this year, but we have 22 fellows from all over the world. In receiving the fellowship, or in becoming a fellow, you do get associate and scholar status at UCSF, which provides access to a number of resources. Our library, which has a massive database of medical journals, a number of curriculum building projects and research applications, which can help support the year-long project. There's structured global health equity curriculum, which is self-led. So this is a compilation of various resources in different topics in global health equity and global surgical equity that we run through monthly and debrief on in our fellowship Zoom meetings on the monthly, but the actual readings are all self-led. And then there's access to a number of tailored courses geared towards supporting research projects and the annual project that fellows complete. So there's some of these are in various stages of development, but we have a number of fellows who have participated in implementation science and quality improvement coursework. And then there will be a dedicated scientific writing course for all fellows this coming year. And we're working on tailoring other courses as well. Next slide. So some of the expectations of the fellowship, as mentioned, coming into the fellowship with a scholarly project. So, for fellows who are applying for this program, we're really sort of hoping to help support either ongoing work or an identified project that could help with health equity in the surgical space within your setting. So that's very broad, but having an idea of a specific project that you want to work on is one of the expectations of the fellowship. Presenting this work, we have work in progress meetings where fellows, it doesn't have to be a completed project, but part of the, I think, career development aspect of this fellowship is to encourage presentation in international settings, and this would qualify. So presenting work in progress at our meetings, or even the larger CHESA meetings, is one aspect of the fellowship. And these are not meant to be like presenting a final product. It's really an opportunity to help workshop challenges that you might be facing with your project for the year, and working with with the fellow community to kind of help meet those challenges, learn from other people who might be working on similar projects, et cetera. There's the health equity curriculum. So readings every month, they're not super burdensome, but we do come together monthly and break into small groups and discuss some of the objectives from the health curriculum. So participating in that, as well as participation in the virtual meetings, since this is the sort of backbone of our program, participating in at least 75% of those meetings every year. Currently, they're held since our fellows are split between San Francisco and mostly East Africa, we have a morning session for those based in the US that coincides with an evening session on Fridays currently. So we may make adjustments depending on where our fellows are coming from throughout the year. So we will adapt as needed on that. We do ask that your fellowship application be supported by a local mentor or supervisor, so somebody who can help support your participation in this program in your home institution, whether that's by granting a little bit of time for the program or helping with your specific project. As mentioned, we'll also help pair you with somebody from UCSF, or we have a number of fellows this year who are working on sort of similar projects. So plugging you into a sort of a project-specific group of working group is one of our goals as well. We do ask that you check in with your mentors at least once a month. We also do a one-on-one check-in with me and Shri at the beginning of the year to help guide what resources you may need to be successful in the year. One of the requirements will be to participate in one of the fellow-led journal clubs. So that's another aspect of our program. We have a pretty robust journal club, health equity journal club program, not quite monthly, but fairly frequently. So in this coming year, we'll ask that fellows group together and help with presenting those topics. And then in regards to your project, seeking grant funding, conference presentations, and publication for primary projects will be is sort of one of the results and expectations of this program. Next slide. So this is just another way of sort of looking at the 4 key elements of our program. There's the curriculum focused on global health equity around surgery and anesthesia. There's mentorship, the year-long scholarly project, and then the community forum fellows. Next slide. In terms of just a few nuts and bolts about the curriculum itself. So as I mentioned, these are self-guided. There's required readings and supplemental readings every month. They correlate to domain objectives in sort of a global health core competencies model that was modeled off of previous programs through CHESA. And then we present this curriculum in small group, faculty moderated Zooms held every month. And we oftentimes have a lecture that lasts anywhere from 20 minutes to the full hour, followed by breakout sessions to discuss the curriculum and discuss any workshops. A lot of these workshops are sort of hands-on and really help to provide support for ongoing projects. So we will do some workshopping where you split into groups and work through and problem solve together. Next slide. Just as an example of our January curriculum, so the domain within global health equity was the topic of collaboration and communication. So these are sort of an example of our required readings. And then the small group seminars that we have for January, we have a journal club, and then what we call the Fellow Fridays. These are the bi-monthly or twice monthly Zoom sessions that we hold. One of those is going to be our first work in progress of the year, where fellows will present on their projects. And then our speaker this month was Dr. Adrian Gelb. He's a powerhouse leader in global anesthesia, and he gave us just a bunch of really lovely career tips from his perspective of a lifelong career in global health equity and anesthesia and leadership. And so that is definitely the career development piece is a big part of this fellowship. Next slide. This just breaks down our community forum activities monthly. I've mentioned most of these, but just for reference, these are some of the sort of remote offerings that support the fellowship. Next slide. And then regarding the year-long project, so again, I've mentioned a lot of this, but each fellow will have a primary health equity project and a primary mentor within their respective specialties. So if I haven't emphasized this is a multidisciplinary fellowship. So you will work with surgeons and anesthetists and multidisciplinary staff across multiple specialties. And I think that's a real advantage of our program, to learn from each other. We offer the one-on-one meetings, and the mentees and mentors will work together to identify courses here at UCSF that may support projects within every respective specialty. There's often other funding opportunities and specific conferences. So part of the mentee-mentor relationship is to really identify what will help each fellow individually succeed with their projects and onward into their career in global health equity. So we discussed regular meetings, and then the primary mentor, as I said, both at UCSF and at a home institution are sort of, I think, a recipe for success with this fellowship. Next slide. Great. This is just a resource. I know a lot of, I've received some questions already coming in about, if you don't have a UCSF mentor, what do you do? And I would encourage you to apply anyways. I think we don't anticipate that everyone will have identified somebody, but it is very helpful on your application if you spend a little bit of time on our website. This is a link to search our sort of faculty affiliates who are associated with global health projects. And so by doing this and just getting a kind of lay of the land of what we offer here at UCSF, it helps us reach out to specific mentors once you join the program. So I would ask for anyone on the call, if you can take some time to try and identify mentors here who, you would be sort of excited to work with. We can help make those connections and help, moving forward into the fellowship year with linking you with somebody who you're really interested in working with. And, I would say more than one person is often fine. Some of the conversations that you have with mentors here at UCSF or otherwise, sometimes it's just like a one-time meeting to really just gain some advice or some, sit down and see if it's a nice match for you to work with with any specific individual. So I would encourage you to select a few people that you might be interested in meeting with over the course of the year, and we can help facilitate those meetings. Next slide. All right, I wanted to speak a little bit about our clinical fellowship pathways. This has created some confusion, and for the ENT portion of it, I apologize for that. We're working on kind of adjusting some of our messaging on our websites, but there is a clinical fellowship pathway that is specific to a few specialties, specifically ENT or OH&S, anesthesia, and urology. These are only available for physicians who are US board eligible, either trainees or graduates, depending on the program, who are eligible for a California medical license, because these fellowships involve some clinical responsibilities at UCSF. So for the majority of interested fellows from LMICs or internationally, this is not applicable. However, there are a number of people who this might apply to. So the structure of the different fellowships is listed here. I won't go into this too much, but you can on our website, there's the ability to reach out to us about specific questions regarding the clinical appointments. But anything done here at UCSF is limited to those eligible for a California medical license. And if you don't, within these three subspecialties, if you don't qualify for the clinical pathways, you can still apply to the core CHESA fellowship. So the remote fellowship is an option for anyone in ENT, urology, anesthesia, and all the other surgical specialties who are not US board eligible. But this is an additional pathway that we offer for these specialties. Okay, next slide. Okay, great. And I'm going to turn it over to Zaina to go over the application overview.
Thank you, Leah. So my name is Zaina. Again, I'm the program coordinator for CHESA, and I've been helping out a bit with the fellowship cohort and fellowship directors this year. So this is just going to be an overview of the fellowship requirements and the timeline. So to be eligible for the remote fellowship, you should be a resident or postgraduate physician or nurse who have completed or are currently enrolled in a health professional training program in a peri-op specialty. Currently, our curriculum and other resources are in English, so We hope that we expect working proficiency in this language to participate fully in the program. You may also hold other professional or academic responsibilities during the fellowship period. So it is kind of built as a part-time fellowship or a part-time commitment, but you should be able to devote adequate time to participate into the program. So that includes participating in the virtual meetings and workshops, following the curriculum, and leading a scholarly project. Our meetings typically take place in the morning over Zoom and Pacific Standard Time, but as Leah mentioned before, this may alter a bit to accommodate whatever our cohort looks like over the next year. So the application requirements, the application date, or the applications opened back in December, but they are due by February 15th by 11 p.m. Pacific Standard Time. We hope that you would complete the application and put it all as one file and email it over to our global surgery email account for review. In addition, we'd hope that you'd have your CV or resume, as well as 2 professional references. One of those references being from your training program director or local mentor. In terms of the application section, this is a bit self-explanatory, but you would need to complete sections A, B, C, D, and there are some optional sections for those applying for clinical fellowship pathways here, E and F, and then G, part 1 and 2, 2A and 2B. 2C is reserved for fellows from low to middle income countries applying for funding support. And there's more details about that in the actual application. But yeah, we are in the application, we're hoping to see that you have thoroughly thought out the answers to the core questions as to why you joining this fellowship, why this fellowship program, and why now in your career. So please keep that in mind while you're filling it out. For the evaluation criteria, we carefully review our applications and all the materials with the following selection criteria. So genuine commitment to social justice, serving vulnerable populations, and in the field of perioperative health equity. We consider flexibility in our applicants, cultural competence, the potential to be a strong advocate, interprofessional and team player kind of approaches. We're constantly working with, the people in the cohort are constantly working with each other, either on meetings, on actual projects, or on other aspects of the fellowship offerings. And then critical thinking about global health and proposed scholarly projects, and the potential impact of the fellowship on an applicant's career. So the timeline overview, so applications again close at 11 p.m. on Friday 15th, 2023 Pacific Standard Time. And then from February to March, we would reach out to some of the applicants to conduct interviews with the fellowship directors. And then by April 2023, the date is still tentative, we will be sharing our decisions. Well, these are pretty much all of the, details of the application. So I'm going to pass it off to Sri to answer some questions or frequently asked questions about the fellowship.
Thank you, Zaina. So one of the questions we are often asked is, what does CHESA look for in an applicant? And so I think at the overarching idea is that we're looking for leaders working in the perioperative space. We want to see how health equity is a core aspect of your work. And we want you to see some identifiable examples of how you've worked to advance health equity through your education, through your research or scholarly work, and through your clinical health experience. And so our 2022 to 2023 cohort of fellows is 22 fellows, including 12 fellows from low and middle income countries, including Nigeria, Uganda, Tanzania, and Ethiopia. And this is an expansion of our initial cohort of 12 fellows. And our program is, I think now one of the largest global surgery fellowship programs in the country. Our current class of fellows are both surgery and anesthesia physicians who are making an impact in health systems and communities that they serve. Over half of them are women, and half of them are from low and middle income countries. Next slide. So here's a snapshot of our current fellow cohort. We're really quite proud of each individual in our cohort, and very impressed at all the work that they're all doing and the unique and the very diverse perspectives they bring to our community. Next slide. I just wanted to highlight two of our fellows here. So Dr. Emmanuel Bua is a registrar in surgery at Mbale Regional Referral Hospital in Eastern Uganda, and he's also an honorary lecturer in surgery at Busitama University. He is a HEAL and a CHESA fellow, and with CHESA, he is implementing a project to establish a student-led surgical society as a tool for addressing global health inequities. And then we have Dr. Yap. Dr. Yap is a resident surgeon at UCSF. She is working on multiple health equity research initiatives, including one focused on pediatric surgical capacity research in Uganda and another focused on quality improvement initiatives for reusing equipment in the operating room and for using reusable equipment in the operating room. Next slide. So this is another popular question about whether or not there is funding support for our fellows. So the CHESA Fellowship offers scholarly project funding support to a limited number of fellows from low and middle income countries. This funding requires additional application materials, and it is optional. So select fellows will receive up to $8,000 in support that can be applied towards their project resources. So for example, fees for IRB, a stipend for data collectors, supplies for data collection, so on and so forth. And so salary, it can also be used for salary supplementation in case fellows need to buy time from their clinical work in order to devote it to their fellowship project. And it can also cover academic conferences, fees, and travel expenses. So for more details about this, section 2C of the application form will have a little bit more detailed information. But of course, you are all always welcome to email us if you have any other specific questions. Next slide. I would like to invite all of you to go ahead and go to our FAQ website. You can find a lot of other frequently asked questions and answers. And I also wanted to take a moment to open up the opportunity for any specific questions that come from our audience today. And so are there is there anyone in attendance who has a question that they'd like to ask now?
Hi, yes. My name is Mark Jobis. I'm the Executive Director of Zamila Sante in Haiti.
Welcome.
Hi, thank you. I just wanted to know from an institutional perspective, what are some of the support that would be required, and how long is their exchange? And I'm sorry, I might have missed this part. Is there time that they would have to pass in person in in California? And if so, what is the overall time that we're considering, and what institutional support would they need in order to be able to successfully do this fellowship?
Thank you for that's an excellent question. Leah, do you want to go ahead? And I feel like you might have started to answer, so I'll let you go ahead and then I'll chime in if necessary.
Sure. Yeah, thanks for joining. So this is a remote-based fellowship in terms of for the core CHESA fellowship offered to participants, especially those who haven't trained in the US. It's generally a remotely based fellowship. So in terms of support outside of UCSF, we do ask that there is a local mentor or supervisor who can help sort of be a point person on the ground for both supporting, I'd say, some time to dedicate to the fellowship, as well as potential mentorship on a project. We do realize that a lot of people come into the fellowship without a lot of resources or sort of background in research, and one of our goals of the fellowship is to help support that. So through UCSF, we will support fellows with research curriculum, coursework, a UCSF mentor, and there is no time requirement to be physically at UCSF. The only exception to that is for our clinical pathways, which are currently limited to physicians who have the ability to be licensed in California, since that it does have a component of clinical responsibility here. And those are only available in ENT, anesthesia, and urology. Within those specialties, however, you can apply for the broad fellowship, even if you are not eligible for the clinical fellowship. Does that answer the question?
It does. I think one of the I wanted to know is like what percentage of protected time, because we would have to factor in backfill. And if we want them to do it successfully, what percentage of protected time would that fellow need to have to be able to be participate in that fellowship?
Yeah, of course. No, that's a great question. Every single one of our fellows has some clinical responsibility to a full-time job in their respective settings, and so we're sensitive to that. I think the actual time requirement to participate in the group sessions is about 2 hours a month, and then the additional readings and research can vary depending on the project, and I think the level of time that fellows have. So I think it's a bit variable, but we sort of average about 5 hours a week in terms of the sort of, I guess, expectation or the ability to succeed in some aspects of this. But we are really, we are aware that this is there's a lot of competing priorities. And so even with the funding, I think that's one thing that we have in our mind's eye. And we do have some fellows who've applied to use some of that funding to help support protected time, even if it's just a little bit of time per month. But we do ask, I think, for in terms of support from mentors, supervisors, et cetera, that there's an understanding about that there may be time to actually participate in the fellowship.
Right. We don't specifically ask fellows to provide proof that their supervisors are going to release them from any percentage for any percentage FTE. So, because we understand that every fellow is going to be in a different position, and every project, will have also different time requirements. And so a lot of, we mainly would like to emphasize that can be flexible in this regard. And we want to mainly see that they have some level of professional and personal support, scholarly support from their institution, a mentor who can provide guidance, and as Dr. Jacobson said, sort of be a point person. But there's not a hard FTE requirement. And I think, we can maybe speak a little bit more, if you like, about some of the breakdown of what the actual time commitments are for the sort of hard aspects of the program, the meetings and whatnot. And then, of course, on the top of that would be whatever they're requiring for their project. But the majority of our fellows are in our non-clinical flagship program, and all of them, I think, have, in addition to the fellowship, another professional role, in clinical duties and whatnot. And so it's designed to be something that's flexible and that is as additive to what they're already doing on the ground.
Hello. Anika Suleiman from Nigeria.
Welcome.
Thank you for that. I just have two questions to ask on the application. First is the references. When I'm submitting the application, is references supposed to be attached with other documents, or has to be sent privately to CHESA? Then the other question I also want to ask is regarding the funding. Am I going to apply for that with the application, or after I've started the program already? In case I'm choosing.
Yes, thank you. So with respect to the funding part of the application, that is a part of the initial application. So your initial application bundle will include your it's almost like a brief research proposal as part of the funding, which sort of represents the funding application. And after, for fellows who are accepted into the program, there may be an opportunity to revise that, afterwards. But as for the first part of your question, whether or not reference letters need to be submitted with the application bundle or submitted via a separate private manner, I'm going to ask Zaina Tamalier to answer that for us.
Hi, thank you for that question. I mean, we haven't really, if it is possible, it would be a lot easier for us to kind of compile your application. If you were able to send it in yourself, like attached to the email that you send with your application. However, I know that these references might take some time to gather. And as long as they're submitted by February 15th, if they're able to indicate, of course, your name, and we'll be able to accept it and put it with your application, if that answers your question.
Thank you.
So,
I see that, is it Ornella saying?
Yes.
Hello.
Thank you. Hello, my name is Ornella Center, and I'm a Director of Education at Zamina Santé in Haiti. My question is about the local supervisor that do you already have local supervisors, and if you do, or do you what is the process to get on that for the fellow to get one of the local supervisor?
Most of our fellows who are applying for the fellowship or who are our fellows currently have at some point, during their training or, during their career, have established relationships with other peers and, mentors, senior mentors on, in either their country or locally, and who have been working together with them on various projects, or just have been sort of career mentors. They don't necessarily have to be specific research mentors. And most of our fellows have someone identified in that regard, but not everyone always does. And so in the course of applying, if there's someone interested who doesn't have a local mentor, we don't want to discourage them from applying, but we do want to help get them started, thinking about who in their lives and in their current sphere may be a supportive presence in their careers, and then to approach that person, and then to simply ask if they'd like to be involved in being a mentor. And so it's if I would say for any applicants who currently don't have someone who they can identify as a mentor locally, to think about who they want, or who might be supportive in their sphere. If they can't identify anyone, then to reach out to us, because we might know someone who might be willing and able locally, depending on our own connections and networks. And so I don't want that to be something that prevents people from applying, but I do want everyone to understand that having a local mentor will significantly increase the success of the fellow throughout the year. And and we're hoping and we're looking for every fellow to be successful in that endeavor. Does that answer your question?
Yeah, the second part of this question will be mostly about if the fellow choose one mentor, do you have a program for that mentor? Because this person needs to know how to accompany this fellow. Do you have any special program for this?
Yeah,
for those people?
That is an excellent question. So many of our Friday sessions involve mentorship, and actually, for example, the most recent Friday session we had was actually a lecture on how to be a good mentor. We have about mentorship, how to be a good mentor and a good mentee. So we do have various opportunities for mentors to join in on the sessions if they'd like, to help also sort of boost their own mentorship skills and knowledge. And we do have some general guidelines about mentorship that we're happy to share with mentors. We don't have, I would say, a separate formal curriculum for mentors, and that's something maybe for us to think about in the future. But at the moment, the curriculum, so to speak, for mentors is informal and ad hoc.
We do have a couple of documents offered through UCSF on the topic of mentorship. So I know I've used that as a resource for myself, and as of many of us. So we would happily share that with any local mentors. And I think it's a good point, something for us to put up on our website as well. And actually, I think it is available through the CHESA website already, so we can direct to that.
Dr. Bakuru. I think you're muted. There we go.
Thank you very much, Jacobson, for your wonderful presentation. I'm John Bukuru. I'm from Rwanda.
Welcome.
And, I'm very happy to meet you. And on this platform, I'm an ENT surgeon and also lecturer at the University of Global Health Equity and also University of Rwanda. So I have one question about a local mentor.
Mm-hmm.
Does he have to have done a CHESA fellowship also, or can it be a mentor who has other expertise?
Absolutely, yeah.
Yeah, thank you.
Ahead.
Oh, sorry.
Yeah, no,
it does not have to be a previous CHESA mentor. This is a fairly new fellowship, so we don't expect that at all. And I think having a supervisor or mentor in any area of study is good. If it's related to the project that you plan to pursue in the year, that's wonderful. So yeah, just somebody who can help be sort of supportive. To expand on the last question, which I think is relevant, in some cases, the mentor has been just a direct supervisor who can help with, again, sort of securing time and help with logistics at your respective site in terms of participation in the fellowship. Yes.
Okay.
Thank you for joining me, Dr.
One second question.
Yes.
Yeah, about granting projects. We are in low and in middle income countries, such as Rwanda is concerned. What is the process of applying for application? Because I have a big project that I'm doing on newborns for hearing and genetic screening in Rwanda. So of course we don't have the genomic sequencing in Rwanda. That one will be requiring really a lot of support. So that's why I would like you to benefit from your grants, that this project can be feasible in Rwanda also. What are the process?
Yes, thank you. So in our application, there's a grant, a funding proposal portion of it, which is it's sort of it really just asks for more details around the project that you're doing and how you would intend to use that funding. It's a relatively small amount of funding offered through the fellowship. The current sort of max is $8,000, and it just depends project to project, and how that would be allocated. But I would encourage anyone applying to put in those details ahead of time, even if there are certain aspects that you may not fully have figured out yet. I would encourage everybody applying to at least submit an initial application. We do have a process, as Shri mentioned, to review those and ask for revisions. So you may not receive the funding, say, right at the beginning of the fellowship, but we have a process in place to sort of gather more information as needed. Additionally, I think a big advantage of the fellowship is there are a number of opportunities that CHESA hears about funding-wise that are offered through various other organizations, and we really try to provide that information to all of our fellows. So even if it's not funding offered directly through the fellowship, there have definitely been some grant funding opportunities that have come through. And so I think another job that we have is to act as a resource for all of our fellows to sort of be aware of those opportunities even after the fellowship, so that you can remain on lists where this information is provided if we hear about it, and then working with your ongoing mentors, UCSF or local, to apply for and hopefully receive these grants. So we do offer a grant writing workshop as well. So that's something we do early in the year to kind of help support that. And then that is, something I think a number of our fellows work with their mentors on throughout the year, is applying for bigger grants for a project such as what you're talking about, Dr. Bakuru. I think we we have a question in the chat I can answer if possible, from Dr. Mark Jewell. If they do not get funding, should the institution prepare to support the research? So that's a good question. I think what I'll say is I would encourage everyone to apply, and if there are aspects that, you know, maybe don't make an applicant qualified to receive the funding, we may ask for more information and try to elucidate. I think, you know, as our goal with the funding is really to help support what you can do in the year. And so, you know, I think if there's a question about details that are required, we really work with you to really try and grant that funding. But if, you know, if for the example, I think in the last question, these larger projects, we may not have the capacity to fully fund them. So I think, you know, using this fellowship as an opportunity to flesh out some of the details of the project, even if it can't be fully supported, and then using what you put together in the course of the year to apply for larger grants may be one way to think about these sort of longer term projects that might require more funding. You know, I think that's part of this this opportunity is really to gain a skill set in applying for larger funds. And we have a number of fellows in that position now. Any other questions?
Yeah, I would stress that we make every effort to support, you know, feasible proposals for projects and for professional development opportunities from our LMIC-based fellows. And just to reiterate, I wouldn't not apply because you're concerned about what you would do if you don't get the funding. Just apply, and you know, for fellows who are accepted, we will do our very best to fund the things that are feasible and to help support your applications for the rest. So I oh, sorry.
Yeah, this is Inka Suleiman from Nigeria. I just want to ask one question about I want to ask a question on what is health equity that you mentioned? Equity. Mm-hmm. Equity. You are saying something about it, that what you are doing should have like these equity. What do you mean by that? That's what I'm trying to find out.
It's a good question. There are, I would say, in our, you know, health equity / global health community, there's probably some varying definitions of this. I think the very broadly accepted definition would be that, you know, health equity is simply trying to identify what people need in order to achieve equality with respect to health outcomes, and then attempting to move populations and individuals into that direction. That's a very broad definition. Most of the work done by people in LMIC countries with respect to improving health outcomes would fall under the category of health equity. And I think when we are evaluating whether a project is aligned with health equity, you can trust that the definition is somewhat broad. It might be easier to identify something that's not health equity. You know, so if a US-based applicant wanted to, you know, create a new surgical device to be used for cosmetic purposes, that might not be something that falls under the realm of health equity. But you can imagine that a lot of the projects that are that aim to help people in a vulnerable, anyone who is a member of a vulnerable population or a historically marginalized individual population, I think all of those would probably fall under the realm of health equity. And so I hope that helps to provide some clarification.
Okay. Thank you. Thank you.
If it's helpful, just to mention a couple of the projects that our current fellows are working on. So, this year we have some pediatric surgeons from various countries looking at the sort of limitations to pediatric surgery in their respective countries, access to care. We have a number of fellows working on trauma education in rural parts of Uganda. In the ENT space, we have a fellow looking at aerodigestive foreign bodies and the burden of that in Tanzania, and then how to best provide some public service messaging around prevention for that. So there's a really wide variety of projects that one could undertake. And yeah, to reiterate what Shri said, I think a lot of the work being done by our LMIC fellows, just by virtue of the population that you work with or the setting that you work in, will qualify.
Wonderful. So we wanted to just have some key dates for everyone to keep in mind. And I think as we close, Zaina, hoping you could just put that slide up. We wanted to just thank everyone for coming to our session and for considering applying to our program. We hope that if you have questions, please don't hesitate to reach out to us. We'll do our best to answer them. I want to encourage everyone to, of course, apply. So our application process opened up about a little bit less than a month ago, and submissions are due in a little bit more than a month on February 15th. We will have an interview process for our finalists over the course of February through March, and the interviews are somewhat on a rolling basis. And then selected fellows are notified and announced at once in April, and then our fellowship will begin formally in August. Thank you all so much. It's been so lovely to see everyone here from all over the world. We wish you the best new year and luck in your professional work. Thanks so much.
Thank you.
Thank you. Bye.